四山洞拐至下升线，广州市当中。
Programa que tiene una arritmia leve.
Welcome to the Huawei EcoConnect Europe 2021. My name is Marit van Boheem and I'm happy to guide you through today's session, Smart Healthcare in the Near Future. Due to the impact of the epidemic, we discovered that the current healthcare system in Europe needs to be further digitized. However, many hospitals are facing lots of challenges here. So, what are those challenges? Let's see. Before we start, I would like to introduce the rules of Lucky Draw. Please fill in the survey and know that we have a very nice prize. We have 4 Huawei FreeBuds 4i as the prizes. And at the end of the session we will select 4 audience members who filled in the survey and they will win. Let me first introduce our moderator, Mrs. Simonetta Quattrociocchi. She's Huawei's key account manager and she's responsible for public customers in Italy. She will talk to Mr. Simone Preti, our healthcare expert from Huawei's EBGW EU. He worked in healthcare for over 10 years. And we also have Mr. Roberto Tordi, who is responsible for the digitalization of the Milano Galeazzi Hospital.
Thanks for the introduction. As you said, today I'm pleased to have this open discussion with the two experts of the healthcare market, Mr. Roberto Tordi and Mr. Simone Preti. Why, Simone and Roberto, you don't start by describing your role in your organization and your main responsibilities?
So, my name is Simone Preti and I am the healthcare expert for Western Europe in Huawei. My goal is, from one side, to better let Huawei understand the healthcare market, and from the other side, to let the market know more about Huawei's solution.
Hi, I am Roberto Tordi. I am a biomedical engineer. I am the CTO of Galeazzi in Milan, and my role is to cooperate and be compliant with my mission of my organization to let the patient the best healthcare experience, starting for instance from the interconnection of all the healthcare devices.
So, Roberto, as far as I know, your job is more oriented to integrate in an efficiency way the different digital devices and modality systems in the process care by improving the interconnection between heterogeneous amount of systems. My question is, how do you integrate the different roles between clinical engineer and CIO and CTOs?
Yes, for sure, we have integrated activities. We have always to be in touch with each other, and at the end you cannot connect any digital system to the IT solution without having a deep cooperation between the two roles.
I believe in any case that we should be patient-centric, means patient-oriented care, being at the same time data-driven. What do you think are the factors that should drive these new changes in the healthcare system? Simone.
Well, in terms of digital transformation, we need to have a robust data strategy, creating value for the data. That doesn't mean selling data, but more consistent information that should help doctors to make better diagnosis by applying a data government strategy.
Roberto.
Yes, indeed. Yes, indeed. It's important to define where to get data, how to maintain data during their lifetime, what architecture use, how to let all systems interact each other.
I believe that how to extract value from those data can be a good challenge, isn't it? And what about the research? We hear every day someone talking about AI, artificial intelligence, of course. What is, in your opinion, the key role of AI in the healthcare or better, hospital environment? Roberto.
AI can be implemented in different parts of the hospitals. From a pure networking point of view, we can use it, for instance, to detect the free parking when people come in with their car into a hospital, or can be important, for instance, to detect the medical portable devices where are located with an IoT tracking system in place.
Yeah, we can also use AI to have a second opinion that can help doctors in the diagnosis process or analyzing a huge amount of data in a faster way. I mean, a lot of patient images. When you can compare your patient data with a huge database of patients that had similar diseases, thanks to advanced AI algorithms, you can take an enormous advantage in the patient care. Again, by using AI algorithm, you can, for example, be more precise when checking how a neurodegenerative disease is progressing, for example, in an Alzheimer patient. This simply because by analyzing two MRI brain image sequences done at a certain time after each other, a segmentation software can see some small differences between the two sequences compared to the human eye and check immediately if these changes are in line with the age of the patient disease, or instead the Alzheimer's disease is progressing too fast. Then doctors need to act with a new medical treatment, changing therapy, I mean.
That's amazing. A technology that really helps patients. We definitely saw the pandemic has created high demands for the healthcare system, not only for AI, of course. In which terms, in your experience, what are the challenges that nowadays, after the pandemic experience, we should always consider in our mind in the healthcare sector?
Well,
Simone,
first,
you
thank
first.
you. Well, first of all, we should remember that we had to increase the possibility to make mass laboratory tests. So we should first of all easily connect this data, but also process them in an efficient way.
Roberto,
Indeed, Simone, yeah. We need to modify the overall organization in a very short time. Interconnecting new hospital areas is important.
Yeah.
New portable devices such as X-ray or ultrasound devices.
Yes, I fully agree with you, Roberto. The digitalization process is not something that we could skip. We needed to collect the data, we needed to increase the telemedicine and remote medicine as much as possible too. Then we should not forget that in the digital space, patients want to use multiple devices as PCs, tablets, smartphones, to have access to high efficiency hospital system, to be able, for example, to easily book an exam, to see their images or share these images to some specialists.
Yeah, you're right, Simone. And we need also to allow interaction between different departments. If we could have systems that allow video meetings, video consulting, such as dialogues, and face integration between the doctors belonging to different units, wouldn't be a benefit for the patient treatment. Yeah. Imagine every department with a room where doctors, through an advanced video conference system, can be interconnected with each other. They simply can discuss some cases, can share information without moving themselves, and saving a lot of time just for easily reaching the right people together in the other units of the hospitals.
I agree with you, Roberto. With aging population, we cannot forget that often patients might have more than one disease at the same time. So they do not belong to only one department. Thus, the communication between different units is very, very important. Then, what do you see from an infrastructure point of view, the new challenge in terms of interconnections? Simone.
Yeah, well, for sure, each hospital should be all interconnected, not only locally, but with other hospitals too. And as we said before, also with patient home and remote monitoring or telemedicine. And why not with nursing homes too?
Roberto.
Yeah, in general, the technology requirements are the same: high speed, low latency communication, possibility to manage a large number of users at the same time, the possibility to refer to a common clinic database. All of this becoming mandatory in this after-pandemic world.
Great. I believe that both of you representing extremely professional and valid people working in the hospitals did a huge and super job in the pandemic area, as well as doctors, nurses have done. You had to solve new problems while you were living the problems themselves. Congratulations. We have learned that we cannot anymore be late in the technology, right? We need to be prepared and structured for the future. We have learned the lessons, and you gave me a lot of inputs with your answers, and they generated new questions. First of all we are living a green transition. A lot of PNR funds are going to be in this direction. How did you see it implemented in the hospital organizations, Simone?
Well, from my point of view, if we are able to use fiber channel networks inside the hospital instead of copper ones, We should use passive and not active devices, for example, saving power consumption, placing less space, less volume, less weight, and a longer lifespan. Not bad at all.
Not too bad.
Also, the use of the telemedicine can reduce the patient move in this green direction. Of course, we need to synchronize doctors, patients, and related technology. As well, critical patients that might have difficult to move might be visited at their home. We already saw some mobile clinics performing home radiology services. Some technicians go to patient at home and make X-ray exams. But what we didn't see is to receive immediately the report after the doctor has seen images from remote hospitals, being sure that he could receive immediate full resolution.
That's very interesting, Roberto, very interesting. Continuing in this direction, what do you think that are the other services and other needs, of course, for this digitalization process after the pandemic?
Well, for sure, as already mentioned, we need to let the customer get access to his own information according to GDPR regulation that we will talk maybe later on, by creating an efficient patient portal, and we need to allow access from any mobile device too, via app, for example. We are looking at the world where the new technologies are coming into the market. One of these is the digital tutor. It's a kind of new virtual AI person that can interact with you as a presence in the screen or as a virtual hologram person. Thanks to the new technologies, we will have soon a digital person that will not only give us information, but will interact directly with us and will interactively answer to our question. I'll give you an example. Through some sensors, already today we can collect patient data at home by using specific sensored t-shirt or smart devices. We are able to give you heart frequency, body position, breathing frequency, but what new AI technology can give us is the interpretation of the facial and voice emotions. It's different if, for example, I ask you, how are you? And the question is simple, good, or maybe good. Now the technology can interpret what we are saying and act consequentially.
Wow, it seems sci-fi. Roberto.
Yeah, indeed. But we are not too far from that. If you think that today you can use your smartphone with the proper probe and the related software app to have the first level of ultrasound examination, you can imagine how technology has moved fast during years.
Really fantastic. And Simone, what about the data collection? We saw in Italy, but also the general trend in Europe, the decision to move into PAC or the cloud. I mean, we could talk for days about this, as we are always commenting. But in particular, in the hospital environment, how do you see the scenario? I mean, is it applicable at hospital level? And what about in terms of data protection, data security?
We definitely saw the move to cloud direction at the country level in EU. In the hospital, we have an heterogeneous amount of application and solution that need to be highly interconnected. We needed to keep some software locally for a lot of reasons, but we should adopt in the short term period a centralized data storage solution policy in the cloud or in a data center.
I fully agree with you, Simone. In our group, for instance, we are already using a common archive to store centrally all the information, and it's completely transparent and efficient to the end user.
Yeah, we should not forget, for example, that hyperconvergence is always an option that we can adopt locally. In few words, it means that we can interconnect more different virtual machines, switches, servers and storage in an easier solution with a common infrastructure guided by the software, and easier and cheaper to maintain too.
This is extremely interesting. Concerning cloud solutions, what do you think it will be more used? The private cloud, for example, as a private data center, or more a public cloud store all of the information?
Interesting question. It depends, first of all, from the infrastructure point of view. Data security and data protection, GDPR, are fundamental characteristics to take in consideration in this case. In general, for not clinical data as administrative data, invoices, etc., we can use also public cloud as incubator where to store all the information. But when we are talking about sensitive data, such as medical reports or also patient images, we should maybe prefer a private cloud or private data center.
Yeah, and Simone, I agree with you. The trend in any case is to centralize all the EPR, I mean electronic patient record information, medical images, and any patient-related videos, and retrieve them when needed in a secure way, and only for the specific purpose of use.
Yeah.
Many thanks for your explanations. Now, please, let me recap a little bit more about what we discussed today. We talked about the new challenges of the digital transformation, from new AI solutions that can help to support doctors or make better analysis. New AI tutors can interact with patients in an innovative way. New services such as the Internet of Things, tracking solutions that require high-speed network infrastructures. New video communication systems to easily let the doctor interact with each other. The need of high-performing networks, interconnecting, allowing hospitals to be interconnected, nurseries, homes, and patient homes too. The need to collect and share patient data to have a better diagnosis. New storage needs in private or public cloud and data centers. Now, I have a last question for both of you. What about cybersecurity and privacy? What do you think about it? Why privacy is so important? Simone.
Well, first of all, privacy is something established by the law with the famous GDPR regulation. Privacy refers to the ability to make personal decisions, having personal dignity and respect. Then also it's important to use data just for the purpose of the use, not for something else, for example. Try to imagine what can happen if patient data are disclosed. There can be some embarrassments, discrimination, and also economic implications too. Roberto, what do you think?
Yeah, yes, indeed. Think about what could be happening in the hospital. In our hospital, that is an orthopedic oriented, generally, we do not save images in our parts when we are performing, for instance, football player knee, memorize or X-rays exams. Can you imagine the effect of disclosing such as information?
Yeah.
We also always think to protect the privacy of our patient, obviously.
And in terms of cybersecurity, what can we say? I mean, we saw recent cases from the news where some hospitals had important hacker attacks. Do you think, your comments on this, Simone?
Yeah. Well, concerning cybersecurity, we always need to keep updated our solution constantly. It's a continual effort to detect, maintain, patch and refresh all the systems related to the security and the related application of security policies. We need to protect systems, data from cyber attacks, viruses, steals, false or vulnerability, during maintenance and so on.
Oh, it's very interesting. Privacy and cybersecurity, I think that they are very correlated. So, time runs fast, guys. I want personally to thank Mr. Roberto Tordi. Thank you, Roberto. Head of the Clinical Engineering of Galeazzi Hospital in Milan for Gruppo San Donato, and my colleague Simone Fretti, for sharing your ideas for the challenges of the digital transformation for healthcare customers after the pandemic. Thank you from our heart.
Thank you very much.
After talking about the challenges, we want to introduce the Huawei healthcare solution to help the end customer to accelerate the digitalization in coming years. Mr. Simone Preti will inform us on how Huawei, as one of the biggest ICT leaders, helps the healthcare customers to complete digital transformation as soon as possible. So, Mr. Preti, we're looking forward for your presentation.
Hello back again. This is still Simone Preti, the Huawei healthcare expert. Today I will introduce you to the smart healthcare solution. For any additional information that you would like to know, please contact me directly on my email that you will see in the bottom on the screen. The contents today, the agenda is to talk about the healthcare trends, the smart healthcare solution, and finally we will talk about Open Lab for open ecosystem partners. What are the challenges that are facing the healthcare sector? From the government point of view, we have an unbalanced resources. The challenges are that 80% of the quality medical resources are concentrated in just 30% of the big cities. Then we saw rare cross-hospital collaborations, low efficiency in emergency rescue. So the requirements are to apply policy and ICT technologies to enhance healthcare services in remote areas and to improve collaboration among medical institutions for emergency response. From the hospital point of view, we saw an insufficient workforce. The challenges are that we saw heavy workload in big hospitals, poor services in primary healthcare institutions. The requirements, so from an ICT point of view, are to improve efficiency of internal collaboration, then support the primary healthcare institution, to improve medical services, and to integrate innovative medical services. From another point of view, from the patient point of view, we are seeing also an unsatisfactory experiences. The challenges are that we see is that we saw crowded consulting room, long waiting time. We saw exhausted and time-consuming traveling for patients in remote areas. And the requirements are to improve working efficiency in these last large hospitals and to reduce time and expensive to receive healthcare services for patients in remote areas. From the authority point of view, I mean from the healthcare authority point of view, we saw insufficient information. The lack of IT solution in hospitals means difficulties to handle public health emergency. Command centers are also difficult to be integrated in this case if we have insufficient and inefficient cross-department coordination. So the requirements are to use converged video on wall to control the overall solution, to manage cross-department collaboration using decision-making systems and command, for an interactive prevention and control. Moreover, we are looking at new challenges in the pandemic era. We saw medical staff infected, lack of experts, wait days just for receiving results, this probably in the beginning of the pandemic era, and in general long queue to make and receive medical treatments. So, what are the new technologies that are helping healthcare industry to step into a new stage? From the hierarchical diagnostic and treatment collaboration point of view, we can see regional healthcare information platforms, medical association, medical imaging diagnostic centers, and the telemedicine center that are going to be installed and be implemented in the market. From the medical big data point of view, yeah, we see that the healthcare big data application enable data openness, convergences, construction, and also sharing. We have, for example, some genome sequences, big data concentration, clinical decision supports, and the statistical analysis of diagnosis behavior. Then from the internet plus healthcare point of view, we are looking at more personalized healthcare. This is the new frontier. We needed to take online appointments and receive remote medical treatment, extend also medical device and other online medical services. So, in general, the technology, the cloud computing, big data, artificial intelligence, the IoT, Internet of Things, and the Internet technologies are going to be widely used in the healthcare because data need to be quickly integrated, shared, and analyzed. So that's all for the healthcare trends. Now let's take a look of the Huawei smart healthcare solution. As you can see here in our slide, we have a wide panorama of healthcare solution. Not all our solutions are going to be presented here. We just put some examples, and let me introduce one by one in these slides. So for example, we have, from the medical imaging point of view, we are supplying PACS, VNA, and the medical images companies by providing them the all-flash storage. We have different types of storage. In this case, on the right side, you can see the HIS and the PACS system. They had implemented two different storages. And in this case, we can see an additional feature called the Hypermetro that allows us to immediately and in a synchronous way synchronize the information between the two storages. The second solution is about the wireless hospitals. Of course, we are providing Wi-Fi 6 access points that are able to interconnect different rooms. Sick rooms, doctor rooms, in a distributed campus network, campus playground, surgical rooms, and also ICU. So from the technical point of view, we can see some advantages of using Huawei technologies, like single access point coverage that enables full senior coverage, so a wide area. So we have also independent RF module that is improving performances compared to other Wi-Fi 6 solutions by 20%. We can see also indoor high-density coverage, allowing ultra-speed Wi-Fi experience in the large scale activities. That some consequences is that user access performance is improved by 50%. We have customized antennas, and interference is decreased by 30%, and performance is in general improved by 20%. One application of our Wi-Fi 6 solution is to integrate new generation of IoT solution. IoT solution are used for different applications like patient administration, asset management, infant protection, or also hygiene management. We can integrate an IoT chip that can integrate some different protocols like Bluetooth, RFID, Zigbee, or also ultra-wideband to interconnect some endpoints like electronic price tag, asset labels, smartwatches, and liquid labels, etc., to new solutions that are going to be generated thanks to our partner. I give you an example right now. First of all, the medical asset management is the first use of this IoT solution that, I repeat, are exactly integrated into our Wi-Fi 6 devices. For example, we can track where are located the wheelchair, the fire extinguishers, but also as well from another point of view, of course, the patients, where the patients are located in some particular areas. And we have real-time tracing management of all the assets, or also patient, if we will see another application, and we can also let patient reach a particular department and decide what is the best way to reach this department, and so on. So this technology is really helpful for a lot of reasons, for a lot of application into the hospital's environment. Another example of application is about the Wi-Fi 6 is the need to manage complex and complex signals, let me say, HD, 3D, and VR, so virtual reality surgery video. Why? Because the need of performance are very high. In this case, thanks to the Wi-Fi 6 solution provided by Huawei, we can increase the concurrency user, for example, to 400 users compared with the Wi-Fi 5 that was only 100. And we can increase the user bandwidth from 2 megabit per second to 8. And we have an industry smart, unique, let me say, smart radio technology that by that we are looking at very reduced latency, less than 10 milliseconds, and we have lossless roaming with zero packet loss for fast-moving services. These applications are used, of course, for example, for virtual reality surgery. Try to imagine what can happen if you miss some data while by remote you are making a surgery application. Of course, it's not possible, and of course, we need stable and very well-performed devices that can help from the infrastructure point of view to manage all of this. Another application that is very well recently used in the hospital is to connect all the hospital in fiber channel and to create what we call optical hospitals. So optical hospitals means use fiber channel to decrease in generally the total cost of ownership, having some benefits too. For example, we can integrate different signals from internet or internet point of view, but also video surveillance or other information, video, for example, that through our OLT systems that can be delivered in the fiber channel to any device that can be located in each floor and to any endpoints. So this is very important because we are using, as we said in the previous meeting, the green energy. So we can save some space. We have a lower power consumption because in the floors we are using passive devices, and of course from the security point of view we have also an additional anti-interference system. We have also experienced the Huawei telemedicine solution. What we can use in this case, we can use our Idea Hub, that is an innovative solution for video conferences. It's an e-whiteboard that handles seamless remote collaboration. We can have here some advantages like the low latency, so you don't have any delay when you are writing to the signals appears on the screen. We have 4K resolution. We can share this information through different systems. We can zoom with gesture as we do in our smartphones. We have also a nice feature that is the co-authoring. So two people, for example, can write in the same screen, also not locally but by remote, and in the same time you can see the screen that shows the signals, and of course we can manage multitasking. Last application that I would like to introduce you is the hospital DR and backup solution. This is for keeping high reliability solution. So it's a second level of RPO and RTO in the same setting, meeting the Tier 7 DR requirements that we can see on the right of the screen. In a few words, for the security point of view, we can copy all the information thanks to our software, so we don't need any external software, but we can directly save all the information is in a disaster recovery center, and it's easier to complete this solution. So let me say that it's all from the smart healthcare solution point of view. Let's now talk briefly about Huawei open ecosystem with Open Lab. First of all, what is Open Lab? Open Lab is an area where we can test all of our combined solution with our solution partner. We have more than 60 solution partners used just in Europe, and we sell all of these solutions where Huawei can put the technology, the service point of view, so from the infrastructure point of view, to our channel partners. And we have more than 1,000 channel partners. And we have also more than 250 service partners in Europe that can be the installer of the solution and can also maintain the solution from the first level, or sometimes also on the second level. So that's all for today. Thanks for your attention, and we see you soon. Thank you.
A warm thank you to all our speakers, and of course to you for joining us today. And you're welcome to get in touch with your local Huawei representative to learn more. Thanks again, and bye-bye.
4山动拐次下升线，广州。